Hello and welcome to Health Matters. My name is Dr. Michael Chillemi. And on this episode, this is going to be episode number 2 in my knee series. So we're going to take a deep dive into knee injuries, specifically knee injuries. In my previous video, we talked about the full anatomy of the knee, what it does, what are the functions of ligaments, bones, the meniscus. And now I want to talk about injuries. So we're going to really get into the intricacies of knee injuries, from common ligament tears to meniscus injuries to fractures to dislocations. We're going to provide you a comprehensive analysis of symptoms, causes, diagnosis, and stages of care and stages of types of treatment that we're going to talk about. This episode will equip you with the knowledge to understand and manage your knee injuries better, whether you're an athlete or someone with an active lifestyle or someone to learn more about knee health in general. Or you're a couch potato and you have knee problems. Whatever the case may be, let's get started. So first thing we're going to talk about is ligament tears. So the first one that I'm going to jump into is the anterior cruciate ligament. So it's called ACL for short. The anterior cruciate ligament is crucial for stabilizing the knee joint. Symptoms of problems with the ACL are acute pain at the time of injury. Often you hear a pop with it, right? You hear not kind of like a snap, but more of a pop. Usually you get rapid swelling within a few hours of the post-injury. And then a lot of times you have the inability to put your weight on your knee. You have reduced ranges of motion. It's one of those, when you feel it, you feel like, oh, something just happened. You know it, right? You know when you have an injury like this. It's not something you're going to be, oh, I'm not sure, did I get injured or not? You'll know pretty quickly. Now, you might not know if it's partially torn or totally torn, but you'll know something just happened. So how does it happen? How do you get this? It could be from sudden stops, changes in directions while running or jumping. Could be a direct collision or impact. Sometimes in high contact sports like football or rugby, a lot of times you're going to see, or hockey, you'll see that, right? In football, especially, you could have somebody running, somebody hit you, and then hit you in the front, and you pop that ligament, or he hit you from the back, and you pop that ligament, right? How do you diagnose this? So typically, orthopedic tests specifically, there's two really good ones. Like an anterior drawer, where you're going to be pulling the leg, and a Lockman's test, we're going to be testing the ligament stability. Imaging, we're going to want to see an MRI, right? You have to see an MRI. You need to see if it's partially torn or completely torn. That's going to be crucial in diagnosing this condition. What are some of the treatments? So typically, conservatively, rest, ice, compression, elevation. That's going to usually what you're going to want to do to manage your acute symptoms. Once you see a physician and they determine you're eligible, then you're going to want to do some physical therapy, right? You need to strengthen and stabilize your knee. And typically the physical therapist will do that. Other treatment options: platelet-rich plasma, PRP injections to promote healing. Surgery. Is surgery ever an option? Surgery can be an option if you have a severe case and you are completely torn, right? Your medical provider will determine if you're a surgical candidate or not. Recovery stages. The initial recovery stage, you're going to manage it with pain and decrease the swelling with rest. Rehab stage, gradual reintroduction of motion and strength training. Advanced stages of healing. functional training, and sports specific drills. Last step is return to active treatment, active lifestyle, depending on the recovery. It could be for anywhere from 6 to 12 months. Now, that is if you have a tear and you have surgery. Physical therapist benefits is an essential component of both conservative and post-surgical treatment. The physical therapy helps restore ranges of motion, strengthen the joint, improve stability, and it gradually reintroduces you to activities to prevent re-injury. Okay, what's the next one? Posterior cruciate ligament. Okay, so moving to the PCL, these are less common but equally significant. So what are the symptoms? Mild to moderate swelling, difficulty walking or bearing weight on the knee joint, pain that can be felt in the back of the knee. How does somebody get this? Typically, the way you get this is a direct blow to a bent knee, such as a fall or a car accident. Diagnosing it, we're going to typically diagnose it pretty much the same type of way, right? We're gonna want to utilize some orthopedic tests, and then we're going to want to visualize it with the MRI. MRI is going to be our go-to, our gold standard for ligaments. Treatments are going to be conservative, again, rice, and then physical therapy to strengthen the ligaments and muscles around the joint. Other therapies, again, PRP. With any of these, PRP is going to be definitely a good option for treatment. PCL reconstruction in severe cases can be a little bit longer. And so, all right, so if you need to have surgery, the early stages, they're going to focus on reducing pain and inflammation. And then later on, you're going to introduce range of motion exercises and then strength training. And again, this is about 6 to 12 months post-surgery, depending on your injury. Physical therapy will play a strong role in reducing the swelling and inflammation and restoring normal knee function, enhancing muscle strength and coordination, especially bringing you back to normal activities. Next ligament we're going to look at is MCL, medial collateral ligament. MCL tears are quite common, especially in contact sports, football especially, one of the most common in football and rugby for that matter. Symptoms include pain that's isolated to the inner aspect of the knee with swelling over the middle part of the knee, so the inside part of your knee. You have difficulty extending it and bending it fully. How do you get it? Usually direct blow to the outside of the knee from contact sports. So you're running straight ahead, someone hits you from the side, and boom, you blow out your MCL. Physical exam, obviously we're going to do some orthopedic tests, and then we're going to confirm it with MRI. Again, same type of therapy as the previous, right? We're going to look to rice, and then we're going to look to physical therapy. Similar type of surgeries to the first two, similar stages. The only difference with this is you tend to heal a little bit quicker, usually about 3 to 6 months. Physical therapy with this will accelerate the healing and stabilize and improve joint function much faster than staying home and not doing it, right? So if you have an injury and you don't do therapy after, you're going to heal with scar tissue. And the direction of the scar tissue could be anyway, right? If you're not doing the proper healing treatments after, the ability for your body to heal effectively can significantly be there, right? It can really cause big problems because even though your body knows how to heal itself, it might not know the positions it needs to put you in or what you need to strengthen. And you don't know what you need to strengthen. Even if you're an athlete, you don't know what you need to strengthen, right? Everybody has their purpose and everybody has their lanes that they need to be in. And a lot of people want to occupy all the lanes. But with something like this, you really need to go with the professional. And the physical therapist is really the one to make sure you're doing the activities, even if they seem easy or seem, I could do this at home. You need somebody watching you, making sure your form is correct, your positions are correct, the way you're doing it is correct, the amount of lifting with weights that you obviously get to at a certain point is correct. Don't discount the ability of a professional to teach you the right way. Because you already, let's say you went through the surgery, you already went through the surgery, you want to make sure that it's healed correctly. Don't skimp on the work at the end. It's important. Okay. Next, we're going to talk about LCL, it's a lateral collateral ligament. So typically with this, you're going to have pain on the outside part of your knee. And you're going to have a lot of knee instability, especially during lateral movement. So your knee's going to buckle to the left or right, right? You're going to step to the right and it might, you might buckle. That's what an LCL tear is. You will buckle. You can have swelling and tenderness on the outside of your knee. Your whole knee could swell up and blow up like a balloon in there, and it could really, really be very tender. A direct blow to the inside part of your knee with a contact sport would be something that caused this, right? So that makes sense, right? So MCL, a direct blow to the outside, LCL, a direct blow to the inside of your knee. Makes sense, right? So you're gonna effect the opposite side of your knee with that ligament, right? With an injury. Okay. Diagnosis, the same thing. We're going to want to do a great physical exam and then MRI to determine if you have a tear, sprain, strain, or maybe a tear or a complete tear, where then you might need surgery. So conservatively, we're going to continue with the RICE and then physical therapy, focusing on the lateral stability of the knee. We also can use kinesio tape, right? Tape to stabilize it. In severe cases, if you have a complete tear, then they're gonna want to look to do surgery. And again, the same type of surgery that the previous ligaments were. Typically, it's 3 to 6 months healing time. Typically, some people could be a little more, some people could be a little less. Not too much less though. Usually, it could be a little bit more if you have any complications. So the biggest thing with this is to really identify what you have going on. Did you hear a pop? Did you hear it? Did you have instant swelling? And what's going on in that segment of the knee? Next, let's talk about meniscus tears. So if you move on to meniscus, it's another very, very common injury in the knee, and it's very prevalent in athletes and the aging community. So what are some of the symptoms? Symptoms could be knee pain, particularly on twisting or rotating, swelling and stiffness, limited ranges of motion, a feeling of knee locking or giving way. So what does knee locking mean? It means you can't unstraighten your leg. It feels like it's locked straight up, right? Or giving way, meaning that when you step, you feel like your whole leg's gonna give out, right? That's what it's. You feel like you're not going to be able to hold yourself up. Causes, what happens? How do you get it? Twisting motions, sudden stops, hyperflexion, direct impact, degenerative changes due to aging. So I do know a little bit about this one. Actually, I know about 3 of them because I had what's called a unhappy triangle, and I'll do a whole segment on it. But I had an ACL tear, an MCL tear, and my meniscus. I had 3 partial tears, which is called the unhappy triangle. And it is truly unhappy. But I did do some remarkable therapies And you'll hear that story coming soon. Coming soon, you will hear it. It is one of the reasons why I focus a lot on knees, to be honest with you. I did that almost 5 years ago. I did it 4.5 years ago, to be exact. And I focus a lot of treatment and healing on knees because I was directly affected, right? So I've learned hard and fast what to do and how to help people, right? I help me, I want to help others so they don't have to, if you don't have to do X, let's say you don't have to do surgery and you could have alternate treatments. They're out there. You just got to figure out if you're a candidate. Some people do need surgery though, right? If you have a complete tear, guess what? You need surgery. There's no two ways about it. But if you have a partial tear, there's a chance. Maybe not everybody. That's up to your medical provider, but a partial tear, you will have a chance. And a very, very good chance at that. I'm a testament to that. Because right now, no surgery with an unhappy triangle. And I lift pretty heavy weights. And no surgery. And I'm not young. I mean, I am young, but not really. Kind of. Okay, I digress. In diagnosing meniscus, we're going to definitely want to do a great physical exam and MRI. MRI is going to be the key to a lot of the knee conditions. MRI is really going to be key to determining if you have a tear or not. And it's important to really get the MRI and find out what is actually happening. Okay. So what is some of the things that you're going to want to do with your meniscus? Obviously, physical therapy. We're going to want to strengthen the area. We're going to want to get your quads and your hamstrings strengthened. You want to get your body moving in certain functionalities to get yourself healing. We're going to want to we could do chiropractic therapy. We could do some occupational therapy to get you walking and stabilizing. So there's a lot of different things we can do. For this type of surgery, if you need surgery though, it's going to be more arthroscopic surgery. Whether you're going to do a meniscus ectomy or meniscus repair. So what's the difference? So if you have a meniscus ectomy, meaning they're taking out the whole disc, if you're doing a meniscus repair, they're taking out a little piece. So there is some controversy on this because what they used to do is take out the whole entire meniscus. And what they found is if you take out the whole meniscus, you tend to spike your arthritis much, much faster, 3 to 4 times if you left partial there. If you left, if only one part of your meniscus was bad, you took that part out, you left the other part in, you did not deteriorate nearly as quickly. When you take out the whole meniscus, you become arthritic much, much faster. The bones become very, very close to bone on bone very, very quickly. And that's what they found out over the last 5 to 7 years. So, everything that they knew in the 80s and 90s, they knew from what they learned. And as they continue to progress, as we progress as medical providers, we learn different things. And the newer, I'm going to say the younger doctors now, younger surgeons, are less likely to take out the whole entire meniscus. Okay, so what's the typical time as far as surgeries? 3 to 6 months. Obviously, physical therapy is needed to help regain function, reduce pain and swelling, and get your muscles strong. You got to get strong. With this, you got to get strong. Okay, let's move on to the next type of injury, fracture. Fracture is very serious and significant, right? You could have a significant injury from this. So what are the symptoms? Obviously, severe pain after an injury, right? It doesn't take, You fall, you get a severe pain, inability to move the leg or extend the leg, or a visible deformity or misalignment of the knee. With this, you're going to have immediate swelling and bruising. The swelling is going to be significant for this right away. Obviously, causes are going to be high impact trauma, such as falls, car accidents, or a significant sports injury. Diagnosis for this, though, is going to be X-ray, going to confirm the presence of a fracture. So MRI will not be as effective for diagnosing fractures. X-ray is your gold standard, or a CT scan if it's a complex fracture, right? So X-ray is for fractures. CT is for fractures. MRI is for ligaments. Treatment, obviously, you're going to be at a surgeon or a hospital. They're going to cast you. They're going to make sure your fracture was either displaced or non-displaced. So what does that mean? So non-displaced means if you have two bones that were together, your bone might have fractured, but you're not moving. It didn't go anywhere. When you're displaced, now it's shifted, right? So normally non-displaced is here, displaced is here, meaning your bone has shifted, and now your doctor has to realign your bones to put them back in proper alignment, right? That's what that means. So with the surgical intervention, obviously it's going to be a little bit of a process to get that done, and it's going to take time, right? Immobilization and pain management therapy with it, and then you're going to be into a physical therapy program. You're going to be into the ranges of motion. You're going to get your strength training. You're going to get all your exercises in rehab. Typically, this is about a 6 to 12 month process, depending on what type of fracture, how did you fracture it, how big the fracture was it a complex fracture, right? Again, the key for this is you have to get into therapy, especially if you're immobilized for a certain period of time. Your muscles on that side of your body will be weak, right? You're going to have your one good side, and then you're going to have your side that you haven't used your muscles. Your muscles will be weak, and you have to restore them. And your physical therapist will be the one to do that. They're going to be crucial for restoring mobility post-surgery. They're going to be responsible for getting your strength of your muscles up, improve your overall knee function and stability, and ensure that it's gradual enough so you can return to your daily activities. You're not going too fast, you're not going too slow. You gotta know how to do it just right. And that's what they do. Okay. Last one that we're going to talk about in this segment is dislocations. So this is a common condition that's requiring immediate medical attention. So usually the symptoms are acute, intense pain with visible deformity, indicating the bone is out of place. You can see it. You will see this. You're not going to be unsure of it. You will see it. You're going to have significant swelling and inability to move the knee. Typically, this is from falls, trauma, like a significant fall or a significant accident or a significant sports injury. Diagnosis it, obviously we're going to assess it with a physical exam, and then X-ray will be the gold standard for this one to determine if it's a dislocation versus fracture, right? So you're going to want to distinguish, is it a fracture or is it a dislocation? And that's what this is going to do. So conservatively, immediately reduction or realignment of the joint, and then you're going to be doing physical therapy after. Surgery, you really is only done if there's damage to the ligaments and other structures around it. Otherwise, you're not. Typically going to be doing some physical therapy and immobilization in the beginning, and then you're going to slowly work back to strengthening it. Typically 3 to 6 months is the time frame that you're going to look at for this. So that pretty much wraps up the comprehensive overview of common knee injuries and their symptoms, causes, and diagnosis and treatment options. Understanding these can greatly help in managing knee health and effectively getting you healed properly. Remember, while medical treatments and surgeries are crucial, physical therapy plays an indispensable role in healing and rehab. Thank you for tuning in to Health Matters. As always, these are my opinions and my opinions alone. If you have a problem, please see a medical professional. This is not medical advice. So next episode, we are going to be talking about number 3 in our study of the knee, and it's going to talk about inflammatory conditions, whether it's gout, rheumatoid arthritis, osteoarthritis, and so on. Stay tuned. If you're not already, subscribe, tell a friend, be well. It's your life. Health matters. Take care now.